Hi Susie, how are you? My name is Ross. I'm going to be your nurse today. I'm going to ask the patient for her name and her date of birth. Upon entering the room, I'm going to ensure that I have all the equipment that I need. I'm providing patient privacy, doing appropriate hand hygiene, and that, she's safe. Okay. Upon approaching the patient, I'm going to visually inspect them. I'm going to ask them if she knows where she is, why she's here today, what brought her in, and what we're doing. Assuming that there is no mechanism of injury or mechanism of illness, we're going to be doing a generalized head-to-toe assessment. In conversing with the patient, I was able to determine that she's aware, she knows where she's at, her level of consciousness is stable and intact. With gloved hands, I'm going to begin my assessment process at her scalp. I'm going to palpate the scalp, looking for any lesions, any red spots, or anything inconsistent with a normal, healthy adult scalp. Throughout the course of this assessment, every time I assess a body part, I'm also going to assess the integrity of the integumentary system. I'm going to check for skin turgor. I'm going to check for any discoloration, any rashes, any sores, any infections, or again, anything that is inconsistent with a healthy adult's skin. After assessing the scalp, I'm going to now move down to the eyes. The eyes are pupils are P-E-R-R-L-A. Pupils are equal and responding and reactive to light and accommodation. And then I'm going to ask Susie to follow my finger up, follow my finger down, left, right. I'm going to pull lower eyelid down slightly. Sclera is white. Conjunctiva is pink. After examining the eyes, I'm going to look at the nose. I'm going to cover one nostril and ask Susie to both inhale and exhale. And repeat the same process with the other nostril. This is ruling out the possibility of a deviated septum. Using my flashlight, I'm going to inspect. Mucous membranes are moist and intact. While I'm doing this, I'm going to ask Susie if she's ever had any histories of head trauma, of any head injuries, if she ever feels or experiences any bouts of dizziness or lightheadedness. After verbally assessing and asking questions about her neurological status, I'm going to now assess the mouth. Looking in the mouth, I'm examining the gums closely, looking for any swelling, any bleeding. I'm going to have the patient put her tongue to the roof of her mouth and stick her tongue out and examine the tongue. No thrush, no anything else that seems unhealthy. After examining the mouth, I'm going to examine her ears. While examining her ears, again, I'm looking for any drainage, any pus, or any oddly colored discharge. While I'm examining the ears, I'm going to ask Susie if she's ever had any hearing issues or uses any hearing aids. Assuming that's not the case, I'm going to now move down to the cervical area. I'm going to ask Susie to take her head, turn it left, turn it right, chin to chest, chin up, ear to shoulder, ear to shoulder. Assuming Susie was able to complete all of those tasks, we are assuming that there's been no trauma to the cervical spine and cervical spine function is intact and proper. In the beginning of this assessment, I would have gotten a baseline set of vitals, which were all normal and in range, and I got her height and weight at the beginning of this video. I am now going to auscultate her apical pulse. Auscultation of the apical pulse takes a minute in practice. Apical pulse is normal. I'm going to then ask her subjective questions, or if she's had any cardiovascular issues in the past, if she exercises. Also, I'm asking her cardiovascular questions. I'm going to assess verbally if she smoked, if she has asthma, if she has any pre-existing respiratory conditions, or is ever in any respiratory distress post-exercise. Assuming the answers to all those questions are no, I am now going to move on to auscultating her lung sounds. While maintaining her privacy as best as possible. On an actual patient, I would then also auscultate and assess her posterior lung sounds as well. While doing this, other pulse points that I can also assess: brachial, radial, femoral, posterior tibialis, dorsalis pedis, and I just said femoral already. I feel like I'm missing one. And after that, we're gonna assess range of motion of arms and shoulders. Susie, put your arms straight out, arms up, arms out to the side. Doing that is ensuring that her shoulders function correctly and she has proper range of motion and control over her arms, shoulders, and hands. Moving down, I'm again assessing the integumentary system of her arms and now her hands. I'm checking capillary refill, 3 seconds or less. Susie, please squeeze my fingers, let go, push my hands, and then I would have her raise her hands again and pull into my hands to ensure that she has a proper strength in her hands and arms again as well. Now I'm going to auscultate her bowel sounds. When was the last time you ate? What did you eat? Have you have a history of any gastrointestinal issues? Do you have any trouble with voiding? Any trouble with incontinence? Any trouble with constipation or diarrhea or blood in your stool? Assuming the answers to all those questions are no. I'm now going to palpate and percuss. Susie, does that hurt? Is anything I'm doing hurting? Again, assuming that the answer to that question is no, I'm going to move on and ask some questions. If she's sexually active, do you have a history of STIs? Do you have any issues with any vaginal discharge? Again, assuming the answer to all those questions are going to be no, I am now going to move down to the feet. Similar to the hands, I'm going to assess for capillary refill. I'm now going to check range of motion. Susie, can you please flex your ankles? Invert, flex your ankles. Push my hands, invert and pull towards me. Flex at the knees. Lift your feet off the bed. Assuming she's able to do all those things successfully, there's no issues with her feet. Then I'm going to ask her some psychosocial questions. Do you have any issues at home? Do you have any issues with mental illness? Do you have a history of mental illness? Do you have any suicidal ideations and anything of that effect? Do you feel any anxiety other than the fact that you're in here getting a head-to-toe assessment by a student nurse? If the answer is no, we assume her psychosocial status is also intact. Upon leaving the room, I'm going to appropriate hand hygiene. I'm going to ensure her privacy, ensure her safety, position the patient